Peyronie's disease is a scarring condition of the penis that causes penile deformity in the erect state or pain either with erections or at rest. We're not 100% sure what causes Peyronie's disease, but we think probably about 10% of men are predisposed to getting it at some point in their life. We think it probably happens in response to little micro injuries that might happen to the penis during regular sexual activity. 80% of men don't remember a specific injury that led to this deformity. Peyronie's disease can affect erections in several different ways. One is that the scar tissue can limit the stretchiness or elasticity of that portion of the penis, which can lead to a penile deformity. This can be curvature, an indentation or narrowing, or even loss of length. The scar tissue can also interfere with the plumbing, so to speak, of the penis. It can allow blood to leak out instead of being held within the penis. This can affect the ability to get or maintain an erection. Peyronie's disease is diagnosed by obtaining a history from a patient who may have it. I'll ask you whether you've had any deformity in the penis, whether there's any injury that you may recall around the time that this deformity started, whether there's any pain, or whether there's any lump that you might feel in the area of scar tissue. I'll also perform a physical exam to see if I can identify that scar tissue, which we call a Peyronie's plaque. There are several different treatment options available for the treatment of Peyronie's disease. These options include oral medications, which may prevent the deformity from getting worse. There are mechanical treatments like penile traction therapy, which is an external stretching device that you wear. There are also injectable treatments like Xiaflex, which is a medicine that's injected directly into the scar tissue. Finally, there are a number of surgical options that are available. In order to determine which treatment options you might be a candidate for, I always recommend a test called a penile Doppler ultrasound. This is a procedure and a test that I do in the office, where I use an ultrasound to look at the scar tissue and find out what it's made of. During this procedure, I will give you a small injection at the base of the penis on the side that will create an erection. This will allow me to assess and characterize any deformity that might be present. And very importantly, with an erection, I'll be able to measure the blood flow in the penis and look for any structural problems that might be interfering with normal erections. At the end of the procedure, I give you a reversal medicine to bring the erection down before you go home. Peyronie's disease is not a sign of any serious illness like cancer or heart disease. It's something you can live your whole life with and lead a perfectly normal life, except that it might interfere with sexual function or with your own self-image. If you're bothered by the deformity in your penis, that's a reason to have it treated.